Hi everyone, welcome to yet another episode from Practo. Today's topic being aesthetic dermatology. I am Dr. Rajat. I'm heading the medical team at Practo, and here with us is a distinguished consultant, a dermatologist, Dr. Rashmi. She has to her credit 8 years of working experience and performed a lot of procedures and experience, which she is going to share with us today. Dr. Rashmi, the stage is all set and you can begin, or you can add something that you want to speak about yourself before you begin the presentation.
Yeah, hello all. Good afternoon. I am going to be speaking about aesthetic dermatology, the science of beauty. Why is it important to discuss this topic? I am myself. I am Dr. Rashmi Naldeega, and I'm a consultant dermatologist currently placed in Pune. I'm working in Arcus Hospital, and in today's day and age, cosmetic dermatology is undoubtedly the fastest growing specialty, be it our exposure due to our work, travel, social media, and there are various professions, actors, models, news anchors, whose profession itself relies on the aesthetic skin treatments and how they appear. And whether we agree with it or not, definitely our appearance does have a psychological impact. It cannot be negated. And these are all procedures that are backed by a lot of research, and ample literature has been accumulated over the years, and they're all backed by scientific evidence. So there's nothing wrong in considering these procedures, and there are various procedures that are being performed, including botulinum toxin injections, filler injections, threads, chemical peels, lasers, light treatments, non-ablative radio frequencies, hair and fat transplants that are being done. And these are all backed by evidence. And since aging is one inevitable process, it's an ongoing process. It's due to accumulation of physical, psychological, social changes over a period of time, and it is practically irreversible. And facial aging, especially, is of special concern due to its aesthetic and social impact, especially in today's day and age where internet is easily accessible to all and everybody is exposed, even due to their work or due to the way our society is designed these days, where everybody is on social media. Everybody wants to look good, and there's nothing wrong with it because we do have procedures that can take care of that aspect. And coming to aging as such, how does it occur? There are various factors that play a role here. It could be intrinsic aging, where it starts with the appearance of fine lines and the skin becoming thin, transparent. There's loss of underlying fat, subcutaneous fat, leading to hollowed cheek and eye sockets. There is bones that shrink away due to bone loss, leading to sagging skin. There is dry skin leading to pruritus, which is called senile pruritus. Inability to sweat efficiently, and this also causes thermodysregulation. Then there is graying of hair, which eventually turns white. And various factors that play a role here are like the gravitational force, which leads to the sagging appearance, and then depletion of the subcutaneous fat around the periorbital. Buccal fat is lost, the inner line of nasolabial folds is lost. So, and subcutaneous fat accumulation can occur in submental areas around the jaws, the outer lines of nasolabial folds. Then there is resorption of bone and cartilage also that occurs. That also leads to the sagging appearance. The various extrinsic factors that play a role, majorly it is photoaging, sun exposure. In a country like India, we cannot negate photoaging. Photo protection is a must. We are all blessed with melanin in our skin, ample amount of melanin, which takes care of most of the issues. But still, we have to follow sun protective measures. The other factors include pollution, ionizing radiation, chemicals, toxins, and diet, of course. Diet also plays a role. There is in aging, what happens is there's loss of subcutaneous fat, and there is also a development of hyperdynamic wrinkles. Um, Somebody on the social media I just saw was quoting that they don't hold grudges because it adversely affects their skin. And it may not be completely wrong, because too much of expression, like frowning and squinting, all the others also, like the smoking, they all lead over a period of time to the formation of wrinkles. Initially they become prominent on movement, the wrinkles, then later they start becoming prominent even at rest. So it is important to take care of this aspect. There is a scale also, Glogau scale of photo damage, where the wrinkles are typed into type 1 to type 4. Type 1 starts with the early wrinkles in the late 20s, early 30s, where there is minimal photo aging, mild pigmentary changes, no age spots, but minimal wrinkles, minimal or no nil wrinkles. When and type 2, there is wrinkle in motion in the late 30s to early 40s. There is early to moderate photoaging, appearance of smile lines, early brown age spots, and skin pores also become prominent. The skin texture also starts to change. The type 3 is wrinkles at rest. This is at 50 years or older, where there is advanced photoaging, prominent brown pigmentation, age spots, and wrinkles even at rest. There is prominence of blood vessels, and the skin is thinned out. And type 4 is only wrinkles. This is 60s to your 70s, where there is severe photo aging and there is yellow to grayish skin color that occurs. There are precancerous skin changes also that occur, and wrinkles everywhere all over the face. So, coming to photo protection, we have to speak about photo protection because we stay in India where we cannot avoid sun. And this starts with the DNA photo damage and UV generated reactive oxygen species. And then this gradually leads to wrinkles and pigmentary changes. So SPF 30 and above is preferable in our country. And also it is important to, whenever we go out in sun, whenever it's, be it a holiday, be it our daily commutation, it is also important to physically protect ourselves, like covering ourselves with a scarf, wearing fully covered clothes. If we are directly in the sunlight, seek shady areas, and participate in outdoor activities, sports, and all with some amount of sun protection. This is important to prevent the effects that start appearing much later. Initially, we may not know, but over a period of time, this all leads to photo damage, photo aging. So, photo aging can be managed medically. First and foremost is sunscreens, and then there are various other agents like topical retinoids. Topical retinoids take care of various problems that occur with aging, like the surface roughness, the dyspigmentation, and even fine lines. They can also be corrected with topical retinoids if started early. And there are effects like increased collagen in the dermis, in the photoage skin, increased epidermal thickness, and promotion of dermal collagen production and reduction in degradation, and inhibits UV induced matrix metalloproteinases. So retinoid usage can also help, but this should be strictly under a dermatologist opinion only. And other preventive strategies also I would like to discuss, like diet. Diet, there is something called sugar sag. This is when give it to our lifestyles where we are relying on the processed foods, refined sugars, bakery items, junk food, easily available foods, and we are avoiding fresh fruits, green leafy vegetables, and not exercising or having adequate sleep and not really following photo protection. These all result in aging, especially the diet which is really rich in the sugary, high calorie diets, the easy available foods. What they do is they, through a process of glycation, they undergo process of glycation, and they form the advanced glycation end products. These products, they react with the collagen in our skin, they form cross links, and they damage the collagen. The collagen in the skin is the main factor that we need to preserve. That is something that is important to maintain the youthfulness and the elasticity of the skin. So it is important to eat fresh fruits, green leafy vegetables, vitamin A, E, C rich diets. Regular exercise is required. Adequate sleep is required. Avoid strong sun and wind. avoid smoking, alcohol, avoid stress. And in the diet, especially, we can, substitute certain things like French fries with sweet potato fries, the white bread with multigrain bread or sprouted bread. White sugars should be avoided and instead go for honey, jaggery, or fruit. Margarine or butter should be avoided and consider olive oil. Processed meat should be avoided, and the red meat should be avoided. Instead, go for chicken and poultry and fish. Coffee and dairy products should be avoided in some, because certain skin conditions like atopic dermatitis and eczema, psoriasis even, are found to be increased with cow milk. So, in such cases, it is better to substitute plant-based milks, and alcohol and smoking should be avoided. Fresh fruits, green leafy vegetables should be included in your diet. Avoid deep fried. The type of cooking also plays a role in aging. Avoid too much of deep fries, roasted food, grilled food. Go for baked food or boiled food or shallow fried food instead. Here only we speak about the role of antioxidants also. There are systemic antioxidants like vitamin A, E, C. That is why it is important to include fresh fruits, green leafy vegetables that are rich in these vitamins. And what antioxidants do is they directly neutralize the free radicals. They reduce the peroxide concentration, repair oxidized membranes, quench iron to decrease ROS, reactive oxygen species production, and via lipid metabolism, short chain free fatty acids and cholesterol esters neutralize the ROS, the reactive oxygen species. Then again, topically, we can also consider vitamin C application and N-acetylcysteine, which is converted to glutathione. And the next one is hormone replacement therapy. This is for especially women who are going through their perimenopause, menopause. Hormones also play a role in maintaining the youthfulness of the skin. Coming to the surgical management, we go for non-invasive procedures and minimally invasive procedures. Non-invasive procedures include lasers and the light treatments, while the minimally invasive procedures, starting with chemical peels, platelet-rich plasma to botulinum toxin fillers, threads, where I would be predominantly speaking about botulinum toxin fillers and threads. These are minimally invasive procedures and they have been found to be effective. And there is a lot of scientific data that has been accumulated regarding their benefits. First and foremost, I would be speaking about the botulinum toxin. This was first discovered or observed by an ophthalmologist in 1987 that frown lines disappeared after the injection of botulinum toxin for blepharospasm. That is how it came to be introduced into the treatment of wrinkles or the aging. And in 1996, they published the first paper for Botox for cosmetic purposes. And in 2002, it was FDA announced the approval of Botox to temporarily improve the. Again, this is temporary because aging is an ongoing process, and Botox has its timeline. It has to be again re-injected if you want to maintain that effect. So it has been found to be temporarily improve the appearance of moderate to severe frown lines between the eyebrows. This was the first FDA approval. Then various dermatological indications of Botox include the aesthetic indications, of course, horizontal forehead lines, glabella lines, vertical frown lines, crow's feet, bunny lines, marionette lines, dimple chin, and platysmal bands. Dynamic wrinkles always respond better than fixed wrinkles. The 8 common facial wrinkles that we treat include frown lines, crow's feet. I have marked them also in the picture. The frown lines that occur on the in between the eyebrows, the crow's feet that are the wrinkles on the side of the eyes, and the bunny lines on the nose. Tear troughs again under the eyes, nasolabial folds, marionette lines when we smile, especially they are visible. The mental crease and the neck lines. These are the common lines that are treated. Especially the upper face is most more commonly treated than the lower face, and it responds better also. So these are the various type of wrinkles that occur. Coming to the contraindications, patients afflicted with pre-existing motor neuron disease, myasthenia gravis, Eaton-Lambert syndrome, neuropathies, psychological instability are contraindicated. And history of reaction to the toxin or albumin is also again a contraindication. Pregnancy and lactation is a contraindication. And infection at the injection site, if you have an active infection on your face, then we do not go for the injection. Then the relative contraindications again are some medications that decrease the neuromuscular transmission generally should be avoided in patients treated with botulinum toxin. Preoperative counseling and informed consent is a must. And unrealistic expectations are again a relative contraindication, I would say. The patient should be realistic with their expectations. It is synthesized. The botulinum toxin is synthesized by a variety of Clostridial species, most commonly Clostridium botulinum, and it is broken into seven neurotoxins labeled as A, B, C, C1, C2, D, E, F, G, which are antigenically and serologically distinct, but structurally they're similar. Human botulism is caused by mainly type A, B, E, and rarely F. C and D cause only toxicity in animals. Coming to the mechanism of action, predominantly what botulinum toxin does is it inhibits the release of acetylcholine at the neuromuscular junction, preventing the contraction of the muscle. This is what is important. It does it by various mechanisms, but the most important is it inhibits the release of acetylcholine and it prevents the contraction of the muscle. That is what it does. That is what we target. The muscles that are contracting and leading to the wrinkles are what we what we target. So coming to the preparation, serotype A is the only commercially available form of botulinum toxin for clinical use. And the products and their approved indications are botulinum toxin A, which is popularly known as Botox. This is used for cervical dystonia, severe primary axillary hyperhidrosis, strabismus, blepharospasm, neurogenic detrusor overactivity, and chronic migraine, upper limb spasticity. These are the therapeutic indications. While coming to the cosmetic approved indication is moderate to severe glabellar lines. The other form is the botulinum toxin A, the Dysport. This is again cervical dystonia and moderate to severe glabellar lines. The other ones are incobotulinum toxin A and botulinum toxin B, also called zeomin and myobla, respectively. So botulinum toxin A is measured in mouse units. The potency of botulinum toxin A is measured in mouse units, where one mouse unit is equivalent to amount of toxin that kills 50% of a group of 20 grams Swiss Webster mice within 3 days of intraperitoneal injection. According to a report, 1 nanogram of toxin contains approximately 20 units of Botox. 1 nanogram is 20 units. So, 1 unit of Botox is equivalent to 0.05 nanograms of the toxin. And when it comes to the various forms of botulinum toxin A, 1 unit of Botox has a potency that is approximately equal to 4 units of Dysport, and unit of Xeomin is equal to 1 unit of Botox. And it requires 24 to 72 hours to take effect, reflecting the time necessary to disrupt the synaptosomal process. In very rare circumstances, some individuals may require as many as 5 days for the full effect, peaking at about 10 days. The effect of botulinum toxin lasts for about 8 to 12 weeks. Ideally, we ask the patient to come back to us 2 weeks after the injection just to check because we need to be we need to see even while injecting we ask the patient to squint, frown, make various facial expressions to know to what extent that muscle is acting and to calculate the dose accordingly, and we either reduce or increase the dose according to the required amount for that particular muscle. And in case some extra amount is required later at a later stage, then we can decide that in the next session. That's why we ask a review after 2 weeks. The constitution and handling of the toxin is very important. The preferred Diluent is the preserved 0.9% saline, and also non-preserved one can be used. And 2.5 ml of diluent is used for a 100 unit vial. This implies 4 units per zero point 0.1 ml. So after reconstitution, it is to be stored at 2 to 8 degrees for 24 hours. And follow all usual precautions of sterility and skin preparation before injection. See, make the patient sit and chin down and head slightly lower than the physicians. The plastic syringes that are used for insulin injections, the insulin syringes with 30 to 32 gauge needles are recommended. And topical anesthetics are not usually required. Ice can be used as a numbing agent until unless the patient is very sensitive, and doses are tailored according to the mode of use and individual patients, and the dose depends on the mass of muscle that is injected. The larger the muscle, the higher the dose. Various indications are, of course, the aesthetic indications are for wrinkles produced due to persistent muscular contractions, like the horizontal forehead lines, the glabellar lines, the vertical frown lines, the crow's feet, and the bunny lines, marionette lines, dimple chin, platysmal bands. Dynamic wrinkles respond better than the fixed ones. That is a main thing to be considered. And non-aesthetic indications, again, for in dermatology, it is used for localized axillary and palmoplantar hyperhidrosis, and especially the one that is non-responsive to topical or systemic treatment, then Botox can be considered. How do we inject the botulinum toxin, the Botox? When it comes to glabellar lines, the typical approach is into the corrugator. Two injections are required on each side, 1 centimeter above the orbital rim, while the procedures, a single injection is required in the center. And next is the horizontal forehead lines. The target muscle here is mainly frontalis, predominantly it's frontalis. Some interactions can be there from procedures and corrugators and also orbicularis oculi, but mainly the frontalis is targeted here. And here it is very responsive to treatment also. So we have to be careful with the dosage here. And the injections should be kept 1 to 2 centimeters above the eyebrows. And we also ask the patient to make various expressions and mark the injection points. Then we go about with the injections. It is important to start low at a low dose here. And then we may encourage the patient to come back after 2 weeks. If further is required, we can inject later. It is important to also see that we don't go too lateral. This can lead to, again, eyebrow ptosis and or else a quizzical appearance of the eyebrow. The lateral brow lift, it is a personal preference. If the patient comes up with this ask, then we can go for it. Here, the superior lateral aspect of the orbicularis oculi is injected and each side, and 0.5 centimeters below the orbital. And crow's feet, source of the wrinkles here are the orbicularis oculi, zygomaticus major. The snap test is done. If the skin doesn't retract back, it is unlikely to respond here. Here, the beginning entails 3 injections, 3 to 4, maybe 3 to 4 units, centered around a point 1.5 centimeters lateral to the lateral canthus and separated by 1 to 1.5 centimeters. So about maybe 2 or 3 injections we can give here. And the units again have to be seen and measured as per the requirement. If it is not too prominent, we go for a lower dosage. If it is prominent, we go for a higher dosage. The total starting dose is usually 12 to 30 units total, and it can range from 2 to 5 units per injection. Lipstick lines, again, these are due to orbicularis oris. Usual number of injection points are 2 to 6, and 4 sites we start with, and 4 to 10 units, a total dosage is given, evenly divided among the 4 sites. Bunny lines are lines around in the center of the nose. Here the injection should be limited to the levator labial superior aliquanasi to avoid lip ptosis. And here again, we give one injection on each side, and the usual dose is 2 to 5 units, depending on how prominent the wrinkle or the line is. Lip lengthening, this is done for gummy smile, where some people, when they smile, their upper gum is more prominent. This is done for that. 1 unit into levator at the nasofacial complex, just inferior to the nasomaxillary groove. A client who already exhibits drooped mouth corners, we should be careful. And too high dose may cause upper lip ptosis and excessive lengthening or lower lip protrusion. So this is something that we need to take care. Marionette lines are caused by contraction of the depressor anguli oris, or the DAO, a triangular muscle that inserts in the fibers of the mouth corners. And this leads to the appearance of a sad face. The turkey neck is due to the platysma muscle. The platysmal bands that form due to diastasis of the midline platysmal muscle and loss of submental fat. Usual dosage is in women we go from 10 to 30 units total. In men it is a little higher, and for each injection, each band we can go from 2 to 12 injection points in women and 3 to 12 injection points in men for each band. Yeah, so this is for the marionette lines. They are typically treated via one injection, 2 units into the posterior aspect of each DAO. Injections should be at least 1 centimeter lateral to the mouth corner, and a second injection site may be added laterally to target the platysma. Coming to the threads, the threads are mainly of three types that are currently available: polydioxanone, polylactic acid, polycarb caprolactone. PDO threads have been around the longest and are made of a synthetic biodegradable polymer that has been used in surgery for many years. And what is it basically? It's an excellent cosmetic technique to lift and tighten the sagging skin tissue. It can last up to 2 to 3 years. The effects can last up to 2 to 3 years. Thread will form an integral support structure for the tissue of the face due to collagen synthesis. It leads to collagen synthesis, and it gets absorbed into the body, but it works by triggering the fibroblast to produce more collagen in the targeted area. The lifting effect is at peaks. It peaks at 6 months. And there are three main types of PDO threads also: mono, cog, and crew threads. And out of this, the cog threads are more commonly used, and they're more beneficial. Uh, the threading is basically a safe procedure. It's minimally invasive. It's fast and easy also. There are no scars. They're very small injection points, incisions that are made, and minimal risk of bleeding is there. It is applicable to face and various other body areas. It is 100% biocompatible, and only 100% PDO threads should be used to ensure safety. And it basically stimulates collagen production, promotion of local blood microcirculation occurs, and activation of reparative processes occurs. So the cog threads are designed to anchor more firmly within the skin, as they have barbs which upon insertion attach to the skin tissue. The design of the thread helps in distributing the stresses more uniformly and pulls skin more evenly. So it can be injected into the various sites wherever we feel there is more sagging, and we try to tend to stretch the skin in that direction and then inject, and then we ensure the thread is in place. Then we remove that cannula. It is injected through a cannula, and the thread stays inside the tissue. It again takes effect a few weeks, a few months later only, but it does give you that lift. It helps support the tissue and gives you a youthful appearance. So, what are the precautions that we need to take care of before and after the PDO thread? Before the PDO thread, it is important to avoid alcohol at least 1 week prior. Smoking, alcohol should be avoided. And high intensity workouts also 2 days prior should be avoided. Aspirin or any medicines that increase bleeding should be avoided. And do not wear makeup, or again, blood thinners should be avoided. And after the procedure, also direct sunlight should be avoided. Rubbing or massaging face, or making too much of mouth movements should be avoided. And heat producing devices on the face should be avoided. Makeup also should be avoided because we do make incisions, we do inject the cannulas here. So there is a small, tiny wound that is developed. So we should take care that it doesn't get infected. Do not massage or exfoliate it. The thread should be in place. We should make sure the thread remains in place for it to take effect. And avoid placing pressure on your face, such as with side or stomach sleeping. Coming to the dermal fillers, this is the last out of the three. This is the last that I will be discussing when I'm speaking about the minimally invasive procedures that we use to treat aging. Dermal fillers are substances that we in this used in the soft tissue augmentation to enhance or replace volume that is lost in any part of the skin. Fillers form an effective tool in rejuvenation, either as a standalone treatment or they can be done in combination also with laser resurfacing or botulinum injections. They are classified, there are various methods by which they can be classified, either on their longevity uh, into temporary, semi permanent, permanent fillers. Again, in the temporary fillers, they stay in the tissue for less than 12 months, and they have this spontaneous, they start disappearing if the patient is not satisfied with the result. The adverse effect also is temporary, any adverse effect with the temporary fillers. And some of the commonly used ones are the bovine collagen based products, Zyderm 1, Zyderm 2, Zyplast, human tissue derived collagen, Cosmoderm, Cosmoplast, synthetic fillers, hyaluronic acid based fillers. Hyaluronic acid based fillers are more commonly used. And semi permanent fillers, they undergo slow degradation. They stay for maybe 1 or 2 years, and they have longer lasting effect. Permanent fillers, they remain longer than 2 years. Side effects again can be more permanent with the permanent fillers. Based on the site of placement, again, they can be classified as dermal fillers, subdermal fillers, subperiosteal fillers. Fillers. Based on origin of filler material, again, they can be divided into heterografts, allografts, autografts, and synthetic materials. Heterografts include the bovine collagen, Zyderm 1, 2, Zyplast, Restoplast, hyaluronic acid derivative implants, Restylane, Perlane, Hyalafam, and porcine collagen, Permacol, Fibril. Allografts include human derived collagen, Dermalogen, and Alloderm. Cosmoderm as well. Autografts include the autologous fat and autologous collagen that is transplanted. And synthetic materials are also there. Biopolymer 3, bioplastic, silicone. So various areas that can be augmented include the tissue tear trough augmentation, the malar shading augmentation, the nasal augmentation that is also being done, and lip augmentation, which is very common, very popular, marionette augmentation, and pre-jowl augmentation. Contraindications include a positive skin test. Skin test is performed, just a second, in two steps, 6 to 2 weeks prior to the treatment. A bovine collagen of 0.1 ml and porcine collagen of 0.05 ml diluted in normal saline is injected intradermally on the flexor aspect of the forearm. And a positive skin test usually is visible as either erythema, pruritus, or prolonged induration as early as 6 to 48 hours or 4 weeks after the test is done. And this should persist for more than 4 days. This usually persists for more than 4 days, the duration. So if at all any of these signs are visible after a skin test, then we tend to avoid the filler. And the patient with autoimmune diseases is also one contraindication, and history of serious anaphylactic reactions in the past, and any kind of local infection at that area, especially on the face, since we are doing it on the face most commonly, is a contraindication. Keloidal tendency is one contraindication, and unrealistic expectations are cannot be entertained. There are various techniques by which the filler can be injected into the tissue, and the most popular ones and the most common ones include linear threading technique, where the injected filler needle is either advanced or withdrawn within the tissue while injecting the filler. This technique is commonly employed in lips and nasolabial folds. The serial puncture technique involves small aliquot of filler to be delivered to an area via multiple separate punctures. This technique is ideal for depositing filler in the superficial levels of the dermis. It is commonly used in glabellar region to address the fine lines in a bolus fashion. Cross hatching and fanning are other two techniques. These are for the larger areas. They target the larger areas, while fanning is a process of making multiple linear passes along the same plane. There is a single site of where we inject the needle, and then in different planes we deposit the filler without withdrawing the needle or cannula from the tissue. This technique can be useful for the deep malar region and nasal. As I've already mentioned, this is for the larger areas, fanning and cross hatching. Cross hatching is a process of injecting filler in a grid pattern. It is commonly used in the oral commissure. So these are various modalities by which we inject the filler. On the right, we have the linear threading. Either while advancing or while retracting, we inject the filler in one plane. And the other one is serial puncture, where small liquids of filler are deposited via multiple punctures. And then fanning is single site of injection, but in different planes, we start depositing the filler. Cross hatching is again, it's in a grid pattern, we start depositing the filler. Now, coming lastly to medical aesthetics, I would like to conclude today's topic by speaking about the therapeutic indications for the otherwise aesthetically used procedures. Medical aesthetics is, in fact, the use of a procedure or product for a therapeutic indication which is conventionally used for aesthetics. For example, dermal fillers, based on their rheological properties, can be used for lifting and volumizing in cases of volume loss, as in atrophy arising out of lipodystrophy induced by protease inhibitors used in HIV treatment, and Peri-Romberg syndrome. Linear morphia over the, like in this image, there is linear morphia over the forehead, which has been treated with a hyaluronic acid filler and platelet-rich plasma, because this is something that usually affects the face forehead, and it is something that is visible and cosmetically it is a major concern for the patient. It has an adverse psychological impact, so such kind of therapeutic indications are also available. Even in earlobe piercing, where the patient is hesitant for the suture technique that we use, um, it can be corrected with a filler also. Or post-traumatic facial asymmetry also can be treated with a filler. Then botulinum toxin, it is has been used both in aesthetic medicine and as a therapeutic modality also, and it is so sorry. It can be used in case of dermatology. It can be used for palmar and axillary hyperhidrosis, where reduced sweating and improvement in maceration reduced the disease severity in conditions like Haley disease and linear IgA disease also. And novel uses have been described in other conditions like psoriasis, atopic dermatitis, Raynaud's phenomenon, flushing, acne, rosacea, epidermolysis bullosa, scar prevention and their treatment, pruritus, post-herpetic neuralgias again, and other neuropathic pain disorders can be treated with Botox. This image shows the starch iodine test in case of axillary hyperhidrosis, pre-treatment and post-treatment after 1 week of botulinum toxin, revealing the improvement with a few areas. Persistent positive starch iodine test needing additional treatment can also be considered. Dermal threads have been used in facial paralysis by targeting the affected side to improve it by volume. Dermal threads also can be used for facial paralysis patients to improve by volumization and contouring the tissue descent and correcting the tissue laxity, thus preventing drop of oral commissure. Use of barbs to grasp tissue has been used to specifically target the ptotic or sagging skin. Acne scar improvement is induced by inducing tissue remodeling, and hair mass index was also been observed to improve in androgenetic alopecia with monofilament thread injections as monotherapy or in combination with minoxidil. That is another usage of dermal threads. Then again, this is a large lipoma that has been there over the abdominal wall, and this showed a moderate response to 4 sessions of monthly intralesional deoxycholic acid injections. So these are some medical aesthetic points that can be considered as well. And hope this session was informative. I would like to conclude with these topics. Thank you.
Thanks, Dr. Rashmi, for this really insightful and informative, presentation. So, I mean, we are at the terminal part of this particular, session, and we'll take up some frequently asked questions. So, I'll start with something which may not be very technical. This is more to do with, everyday conversation. Nowadays, we get to hear aesthetic dermatology and cosmetic dermatology. Are they interchangeable, or is there a subtle or significant difference? Can you please throw
There's
light
no
on this?
significant difference. When it comes to aesthetic cosmetic dermatology, they are interchangeable. But when it comes to medical aesthetics, that is something, it is for a therapeutic indication.
Right. So it's a very subtle academic kind of a difference. Okay.
Yes.
And then the
But
question
all these
is,
procedures, sorry to
hmm,
interrupt, but all these procedures should be performed by a board certified, qualified, experienced dermatologist only. They are not to be performed by some cosmetologist or a beauty parlor therapy. That should not be done.
this is where I was coming to. I mean, thanks for bringing up the topic even before I put the question forward. So, in the absence of specific mandate by the Indian government, I mean, related to health, uh, which are the, I mean, what are the particular degrees which will entail a doctor to practice aesthetic medicine?
It's somebody with an MBBS degree and a post graduation in dermatology, either a
Okay,
diploma or an MD, only are to be qualified or considered qualified to perform these procedures.
okay. And these are specific certifications. I mean, there is no single one kind of a certification which fits all the
There
shoes,
are
right?
various fellowships, but the foremost is the person should be a dermatologist. Although
Right,
there are certain procedures where therapeutically Botox is used by other professions, in the sense within the doctors only, where other specialities are using. But I am speaking about the aesthetic part where the facial wrinkles are treated. So it is mainly dermatologists only that are performing this procedure, and these cannot be performed by a basic MBBS doctor also. They should be
right.
backed by a specialization only. And
You
later,
might
to
have,
add on to their expertise, they can consider fellowships. But mainly and foremost requirement is you should be a board certified dermatologist. You should be a MCI recognized dermatologist.
right, right. So that was one of the, crux of the issue is with so many digital platforms coming up on a daily, monthly basis. Uh, it's becoming very difficult to understand. I mean, since there is no clarity about which degrees will be accepted, which are not, it's very arbitrary and very whimsical. So that's the reason for this question. And I'll have a follow-up question related to this. That which are the Indian health-related authorities? You mentioned MCI, which is now National Medical Council, NMC. Other than
Yes.
that, are there other, government authorities who are having a close eye on aesthetic, dermatology, they have rules and regulations regarding
Yeah,
this
rules
particular
and
specialization?
regulations. Yes, there is the Indian Association of Dermatologists and IADVL, venereologist nephrologist. But mainly, you have to be somebody who is registered with the MCI or at least the state council, and then only you will be able to practice these procedures. The rules
Right,
and guidelines are, there is an association for that, that is formulated. They perform the trials, they perform the they publish the articles which we go through, and only their evidence is accepted. But the basic qualification and the registration should be there. Only then you can go ahead with actually practicing these.
Got it. Then, talking from a doctor's perspective, I was very curious that what are the, most sought after areas or arenas that you encounter on a daily basis? I mean, from the Indian context, which are the areas people are, coming to you?
Um, in today's day and age, there is no such thing as areas because everybody is seeking job opportunities everywhere. And once that social circle starts becoming larger, and everybody starts getting influenced, and social media influencers, everybody is used to it. So previously, probably the north side, they were more particular, but now even everybody all over the country is very much keen to know what procedures they can undergo, how to look better. So I think now India has changed. This
Uh,
whole division of some region has completely gone. Everybody has migrated to some other place to pursue further opportunities, whether it's because of their job or academics. So it's completely right now. It's everybody is particular about how they want to look.
The reason I asked you this question is 20 years back, dyeing hair was considered unnatural, going against nature, and it's become so common now.
Yes,
So I can very well, understand, considering social media has played a revolutionary part, and
yes.
that social stigma. If I have a problem, why don't I seek professional help?
Yes,
That has
of
come in.
course. Yes, of course. The awareness is definitely increasing. And there is, of course, harm also. Everybody right now is speaking about skincare routines, although it's a little off topic. But right now, except for a dermatologist, I see everybody else speaking about skincare routines. Um, and people are just
Right.
taking up products based on some review or some influencer. So that should not be the case. Our skin is a major part of our body. It's the largest organ, and it is something that is influenced by both external and internal factors. Skincare is definitely a part of healthcare. So we should consider a dermatologist only when it comes to any kind of concern, whether it could be an aesthetic concern or a probable skin disease. Self-diagnosis, over-the-counter treatment, social media influences will not work. You have to go to a dermatologist.
Dr. Rashmi, I have a personal questions. I mean, it's not off the topic. Since you mentioned the social stigma barrier has come down, do you find I mean, is there a gender disparity during the consultation that females are consulting more or males consulting more, something of that nature?
In fact, it is the opposite. Right now, males are also equally or even sometimes more concerned, especially
Right.
when it comes to treatments like PRP or hair transplant. Females, although do suffer from hair loss, but the males are more concerned. I keep getting patients who are 20 years old or even 25 years old. They come in, "Ki, I have a family history. Please, doctor, have a look. Please, start treatment early." So that is the level of awareness. Previously, it was like once they lose all the hair, then they come back to us. So it is not
Right.
like that anymore. Even for that matter, Botox or fillers was kind of a taboo. Like, why should we go for something like that? Now it's become more of a acceptable, or even sometimes a social status also, where people want to say, "Ki I have had this procedure done."
I think another factor is that the financial viability of the thing. I mean, 20 years back, 10 years,
Was very
even
good.
15 years back, you heard only Hollywood celebrities.
Yes.
And then you had the, Indian film industry, be it the North or South, they were the ones. And then there were some cases where, somebody had a really bad lip after the lip, whatever. So, I mean, the classic example being an actress called Koina Mitra. and that scared people. Right now, I think things have been streamlined and people are more open to it. I think one of the factors is definitely financial viability of the procedures.
Yes,
It's
yes,
much less expensive than what it used to be. Uh,
yes.
I had other, I mean, I'm welcoming others to ask the questions, but I have a list of questions if you don't mind.
Sure,
So,
please go ahead.
yeah, what are the current trends? I mean, in India, I mean, which procedures people are preferring? Do they prefer to, exercise option? No, doctor, is there an alternative? Are they very curious about such kind of things, or is
Yes,
it
they
one
are.
side?
They are most popularly the non-invasive procedures or minimally invasive procedures we go for. But right now, even the demand for fillers, Botox has definitely gone up. Previously, it was only like people who are probably not even the TV stars, the movie stars were
Right, right.
going for these procedures. But nowadays, everybody, like even the common people who can afford slightly higher procedures, higher rate procedures, can go ahead with this. And their availability into the market and the professionals who are performing it has also gone up
Right.
comparatively.
I do remember during your presentation, you mentioning that there is a social and psychological aspect, essentially a mental element. So, how do you deal with it? So, I mean, I remember from my medical college days that body dysmorphic syndrome was not so common in India, but it's become, I mean, thanks to social media, whatever, it's so
Yeah.
there would be some patients who wouldn't be satisfied. How do you deal with such kind of do you prime them before the procedures?
Yes,
What
it
do you
is
do?
important. It is important. Unrealistic expectations or thinking that completely I'll go back to the way I was probably 20 years back is not the aim. The aim is to reduce the prominence. The aim is to improve the existing appearance. It is not about, taking you back in time. It is not about that. Patients should realize that. It is about how to improve your present appearance.
Right. And I do remember you stressing on the point that aging is a dynamic process. It's not as
Yes.
if you undergo one Botox session and it gets, cured forever because maybe,
Yes.
I don't know. I'm not, I
So
do not
Botox
have
has
the,
a timeline that people,
okay,
I think they are aware that they have to go for a repeat session. But to think that even after injecting Botox, they'll completely, through some magic, they'll go back in time and look like how they used to. Thanks to our phone memories where we store our previous images, if you compare, you're not going to go back because
right.
everything changes, not just your appearance, everything in your body changes with age. So this is just,
Probably what we are doing. Oh, sorry. I mean, please
yeah,
continue.
please go ahead.
No, probably what we are doing is not cutting the aging process, it is delaying the progression of aging.
Yes,
That's how I.
delaying and to improve, like to decrease the prominence of the wrinkles that are there.
Right, right. And I mean, do what are the risks associated? I was very curious about that. I mean, obviously, it will depend from procedure to procedure.
See, if we follow the precautions, there are minimal risks. With
Right,
especially Botox, what happens is, of course, local site swelling, injection infections. They're common with all kind of minimally invasive procedures, if not done under proper aseptic precautions. But there could be somewhere where you have injected too much of Botox than required. So it can lead to the overactivity, the opposing muscle. So it is important to know the anatomy. Otherwise, it can lead to eyebrow ptosis, eyelid drooping. Um, the
right.
muscle function is completely lost, or the opposing muscle starts taking over. So that balance should be maintained, especially with Botox. That is
So,
why it is important to start with a low dose and then call the patient in after 2 weeks to see how the injection has worked, so that if any additional dose is required, then we can go ahead.
in the rare event of such a event, I mean, instance occurring, is there a way to reverse it? Is there an antidote?
It
I
takes
mean, if
time.
you
It takes time. With
okay,
time, it does resolve. or if it is correctable to certain extent, the opposing muscles action we can target. But it takes time. With time only it resolves.
Okay. And what can somebody who's undergoing these procedures, what should be the expectations? I mean, I sound like a patient. I place myself in the shoe of a patient right now when I ask this question.
Expectations, like I said, it is not reversing your age completely. It is to make you look better and younger by reducing the prominence of how your muscles are working and causing the wrinkles. And by fillers, of course, you can just cause that fullness. Threads can give you that, um, can get rid of that sagginess of the skin. So you will have a youthful appearance, but you'll not go back in age. That
Right,
patient should be clear before going for the procedure.
right. So before I let you go, Dr. Rashmi, I have two more questions
Yeah.
from my side. One is, what are the problems or challenges faced by you while practicing this particular profession, specifically with
If we
patients?
counsel the patient, nowadays patients are well researched. There is a lot of false and fake information also available. But when we try to explain them, they are receptive to most of the things. Until unless the patient really has a very unrealistic expectation or some kind of other psychological issue, the patients do reason and do understand to what extent they can expect the results if counseled properly. So that ways, I have not really faced many challenges with patients that I have come across.
And is there any advice you want to give to your co-peers, because this video would be, mostly, seen by dermatologists. So is there
Um,
any advice
don't
that
be
you would
too
want?
aggressive with any of the treatments. Start counsel the patient well; they will understand. And if they have some query or some fake news that they are believing, try to explain them that that is false and this is what they need to expect out of the treatment. And if there are any adverse effects, try to explain them about the adverse effects, take their consent, and then only go ahead. Don't be too aggressive with the procedures.
Right, right. And one final question from my side, that is, what do you think is the future of aesthetic dermatology in India?
I think it is, we are the future right now. It is something that is coming up in a big way. And yeah, I think in probably next 5 years, this is something that I was discussing with my fellow colleague a few days back. I think in next 5 years, probably everybody before a party they would want like a filler or a Botox touch up done rather than going for the temporary fixes. I think that that is what I believe is going to happen.
We are already seeing that influx,
Yes, already it is there, but still there are people who are hesitant, and I'm
right,
thinking in probably next 5, 6 years that also is going to go.
right. So I am inviting other questions. I don't see any questions right now. But Dr. Rashmi, it was a really insightful and informative thing for me. And once this video is launched, you'll be able to, see the reaction from our
Yeah,
audience.
hopefully.
And to my audience, I say, if you like this video, please share and subscribe to our channel. And I mean, till next time, bye from our end. Thanks a lot, Dr. Rashmi.
Thank you so much. Thank you so much.